Welcome to Medically Speaking. Our guest today is Dr. Sarah Berga, Medical Director of OB/GYN and Women's Health Program Development at Oishei Children's Hospital. Doc, thanks for joining us today.
Glad to be here.
So we want to talk a little bit about gender-affirming hormone therapy, probably a little bit unusual or maybe a topic that is not as well known as some of the others that we've covered in the past. So talk a little bit about the program development role and what you've been tasked to do since you've come here to Buffalo.
So it's actually a really big opportunity and privilege to kind of help grow women's health programs inside the Kaleida Health Network and specifically at Oishei Children's Hospital. So we have, core services that are here. And then we want to have what I would say niche services or focus services where we are able to put together a integrated program that delivers a slightly more focused kind of care, such as what we're talking about right now. And these are always works in progress, and there's new information that we have to integrate into our programs all the time, as well as, always an opportunity for differentiation and creating programs that are relevant to contemporary society.
So on the contemporary note, let's talk a little bit about gender-affirming hormone therapy. I know there's a clinical definition or a medical definition. If you can, for the layperson out there, explain what that means and what the goal is for something like that.
Right. So this is a very new area of hormone therapy in the sense that we don't have a lot of research, and it really is responsive to perceived needs in our communities. So it's basically come to a career focus, if you will, over the last 20 to 30 years, but more acutely over the last 10 years, in which people have really been seeking and looking for what we now call gender-affirming programs. So if you want to switch your gender, so you can't switch your biological sex, that's whatever that is. But if you want to switch your gender, then we have to engage in a series of steps. And one of those steps is hormone therapy. So there are more steps to that. It's definitely a work in progress in the sense that even the hormone therapy recipes, if you will, that we use are being developed.
Sure. And you use the word we. So let's talk about the we in this case. So who can provide? Is it a specialist? Is it any type of provider? Who can provide this type of therapy for a patient?
So, a lot of people who are family doctors and who decide that this is an area they want to specialize in can acquire this special knowledge. But mostly it is endocrinologists and reproductive endocrinologists and pediatric endocrinologists. But, other physician types certainly participate, particularly in the surgical approaches. So this is when you say holistic program, you really need to get all the subspecialty types integrated. And sometimes we do that virtually in the sense that we identify people who are particularly interested in providing care or have special expertise in providing care for people who want to switch their gender. And, this is never a binary conversation for us. So when we say this, we think sex is more or less binary, male or female. But when we say gender, we don't necessarily mean that they're switching into a binary role.
Got it. Is this something that is often requested or needed? And if so, why do individuals end up going through this treatment if there is this growing demand or this needs? Is this something because it's just more accepted nowadays, or is this something that has happened in the past but just wasn't really widely discussed?
Well, I've actually watched this field develop in my career. So, in the sense that the problem was always there, that's true. What we had to offer has changed a lot, and our awareness about who needs it and when has changed a lot. But it's still very subject to different cultural standards in different countries and there are, movements that are culturally specific. So I'm only able to talk about the United States, although we do have meetings, that are professional meetings where we have people from all around the world. And sometimes we compare notes. And, specifically my experiences related to where we are now in the United States.
So as it's becoming more widely discussed, on an international or world level, do you view that as a victory for the LGBTQ community because there's more acceptance for it, number one, and then number two, there's an attempt to be more coordinated?
Yeah, both. So that's progress in the sense that we have more hormonal options to provide. And I say that also with the knowledge that we have more research to do about what's the safest way to sort of approach hormone therapy for gender affirmation. So, if you're a biological man transitioning to what we would call a trans woman, then you have to have, certain therapies to suppress male hormones and certain therapies to provide female hormones. And what is the safest way to do that is still being debated and developed. And the other option that's often not discussed is before people transition, it's good to talk about fertility options because we can now store sperm and eggs, and people want to have fertility preservations. Probably ought to think about that before they go through gender affirming hormone therapy and surgeries.
Yeah, so you mentioned an issue like fertility. So if there's someone that's exploring the transition idea and going down that path, there's obviously a lot of emotions involved. There's an awful lot of research and education, but there's also the question of cost and is my insurance going to cover it? Is this an expensive type of endeavor? So if you can explain a little bit about the financial side of this.
I think it's really spotty coverage at best. And patients are often, they're not selecting their health insurance necessarily for this in mind. And so particularly for the fertility preservation aspects, it's expensive, access is limited, and not every community has great access. Likewise, cost of hormone therapy, now we're talking about forever, and that can be quite expensive. And some of the safest medications are actually some of the most expensive medications. And so it is really a challenge for patients and physicians to do the right thing. And, there's lots of people who want to get involved in terms of second guessing what is the right thing. So we have to deal with society and culture. And it's not just the insurance company. It's a pretty complicated field right now. So I would like to see it more streamlined and access points be more available.
So if somebody's watching the video and they have an interest or they want to learn more, where can individuals find these services? Where can they find information? If they've made a decision, how do they go about this?
Yeah, so it's still word of mouth, and starting with a trusted physician who often can kind of help, or a trusted organization in town that can help. But a lot of people really just start at the internet level and try to find out who's doing what. And the physicians often list their areas of focus or expertise. And a lot of times that's just how we do it right now until we develop a concerted program. And to do that, we would probably need to have a navigator function that we develop. And we're not all the way there yet. But we have had conferences within the Buffalo community to make sure that the people who want the information can get the information at that moment. Doesn't mean we don't need to do more. We do.
That's Dr. Sarah Berga, the medical director of OBGYN and Women's Health Program Development at Oshaya Children's Hospital, talking about an important but emerging topic, gender affirming hormone therapy. Thanks again, Doc.
Yes, thank you.